Okay, welcome back, everyone. We are continuing with our next section of anatomy and physiology, and we're going to be looking at quadrants, which are four quadrants, and then we'll talk about the 9 regions and focus on some of the essentials of what you need to know for that and why they're important. So, if we draw this sagittal, or I should say mid-sagittal line right down the center here, and then I draw a line perpendicular to it going across the umbilical region this way, now we have 4 quadrants. We have a right upper quadrant, a right lower quadrant, a left upper quadrant, and a left lower quadrant. Now, why are these quadrants important? Well, they're important because we have different organs that are located in the different quadrants. And again, this is anatomy, this is structure. We're looking at structure. How do I relate this to healthcare? How do I relate this to something more functional? Patient comes in to the hospital setting, and the patient has 104 fever, and the patient is buckling forward like they have bad stomach cramps, and they look a little bit pale, and they just vomited. The patient is complaining of pain in their right lower quadrant, right? That's what the paperwork indicates. That's what a doctor or a nurse may have written. So when we kind of go, well, right lower quadrant, what do we have down here? Maybe we're going to be a little suspicious that that little sucker down there is inflamed. That's the vermiform appendix. So maybe they have appendicitis. Okay. Patient came in feeling nauseous. They vomited. They claimed no fever. Again, cramping in the abdominal region in the right upper quadrant, and they also have pain on the posterior thorax near the scapula on the right side. Wonder what that could be. What brought on the pain was eating a fatty meal, lots of oily, greasy food. Well, what you will eventually learn is that your liver makes bile. And bile is an enzyme that breaks down fat. Okay? The liver makes the bile, but it stores it right there in the gallbladder, the green gallbladder. So the liver makes it, the gallbladder stores it, and when there's fat that's in the stomach because of something you ate, and the stomach empties its contents into the small intestine is going to secrete something called cholecystokinin, known as CCK. Cholecystokinin goes to the gallbladder and it makes the gallbladder contract, and it pushes out the bile that was stored there, pushes the bile down its ductwork into the small intestine to break down the fat. But if there's a blockage here, let's say a stone, a gallstone, and the gallbladder contracts, the bile gets jammed up in that traffic jam here, and it never makes it into the intestine to break down the fat. You get this accumulation of abdominal discomfort. And when you have stones in here, this is when they want to do a removal of the gallbladder, a cholecystectomy, where they remove the gallbladder, or they bombard the gallbladder with these ultrasonic waves, these pulveronic waves that come in to break up these large stones into smaller and smaller fragments to get rid of them. Okay, but in any matter, this is why it's important to know these quadrants, because you have an idea as to what organs lie in each of the quadrants. Now we have regions, 9 regions. And I've seen this show up very straightforward, which ends up being a drag and drop. When they give you the wording here off to the side, you drag and drop the names into the tic-tac-toe or number sign. Okay, so umbilical is the belly button, so that goes in the center. Epi means above, and hypo means below. Hypo is below, epi is above. So epigastric means stomach, so epigastric is above, hypogastric is below. And sometimes the hypogastric is called a pubic region because it's right near the pubic region. Okay, then we have the left lumbar region and a right lumbar region because it's where the lumbar spine is. Sometimes they call them left flank and right flank. These are the flanks, the love handles, right? And then we have the inguinal, the left inguinal region, and the right inguinal region. It's where the inguinal ligaments are. So there's a left inguinal and a right inguinal. The only ones that are left are the left hypochondriac. Chondria is rib cartilage or cartilage of the ribs. And there's a right hypochondriac, just right under the ribs. So there's a right hypochondriac and a left hypochondriac. And again, simple drag and drop. So the words would be off to the side. I think it's easiest to go right with first, go with the belly button, umbilical region, then go above it, epi's above, hypo is below, also known as the pubic region. Then you have the inguinal regions, left and right inguinal. You have the left flank and the right flank, also known as the left and right lumbar. And then you have the left and right hypochondriac. Again, hypo is under, chondriac is cartilage of the ribs, under the ribs. And again, similar concept where you see we have certain organs in the tic-tac-toe or in the number sign. Okay. Okay, let's look at the planes, right? You heard me say sagittal plane before. So we have these three planes, and they can slice the body into different sections, and sometimes parallel they can slice it in these parallel sections, parallel to a given plane. And we have these three planes of the body, which we're going to use especially for diagnostic imaging, whether it be MRI, PET scan, or even CAT scans. So if we look at the person off to the right, we have this plane that goes from anterior to posterior, right down the center, from A to P, front to back. And by doing that, you're separating. If you do that, you follow that all the way down, right? You're separating this person into a left and right half. So this is the sagittal plane, has the ability of separating the body into left and right halves. This is a mid-sagittal plane because it's right down the midline, mid-sagittal. If it was off, let's say 3 or 4 centimeters to the right of the left, we would say it's parasagittal. It's still dividing into a left half and right half. It's just not dividing into an equal left and right half. Mid-sagittal is perfectly down the midline. It's a equal left and right half. Parasagittal is an unequal left and right half. Okay, now let's change the color here for a second so we don't get confused. Let's make this one black. So now we go this way, going from the person's right to the person's left. And we go down this way. Okay, going from right to left. Remember, this is their right side, even though it's our reading left, and this is their left side, even though it's our reading right. When it separates them from left to right, we call this the frontal plane. We also call it the coronal plane. I like coronal better because when we do osteology, there's a suture called a coronal suture that runs right to left. And then there's a suture going front to back called a sagittal suture. So you have a sagittal plane and a coronal plane, but the other name for coronal is frontal, and it separates the body again into two halves, just a front half and a back half. And then the very, very last, let's make this one, we'll make it green here. This is separating into the body into an upper half and a lower half. We call it the transverse plane. It runs transversely, and it kind of gives us like a bird's eye view looking down and into it. And it gives us a really good understanding of all the parts from anterior to posterior, from left to right. It kind of gives us a great view of everything, and including the depth of things. So here, if we were to cut the body into halves, upper and lower half, what plane would this be? This would be the transverse plane. If we looked at this one, right down the center, that's mid-sagittal. If we look at the second green line, it's still sagittal because it's separating into a right and left half. They're just not equal. So right down the center, we would say that's mid-sagittal. But when it's off to the side, we say it's para-sagittal. Okay. Okay, so drag and drop. Which plane divides the body into anterior and posterior sections? Which one divides it to anterior and posterior? Well, that's going to be the frontal or coronal. So let's go back. They didn't give frontal, but they did give coronal. Which divides the body into an equal left and right half? Well, sagittal goes down the center and it's mid-sagittal. Which one does unequal left and right half? That's the para-sagittal. Whereas the transverse divides the body into an upper and lower section, or superior and inferior section. Now, let me point out a few things here. Now, students sometimes jump and go, oh, I know what that is. That's the right lower quadrant. Boom, let me pick the answer. But that's not what they're asking. What is the medial border of the highlighted section called? So up here is the superior border. Here is the inferior border. Here is the lateral border. Here, this is medial. So what is this medial border called? You would have to look for sagittal or mid-sagittal. Okay. Now, I also want you to see, here's the clavicle. When there's a line that's right through the center of that, they call it mid-clavicular line. A mid-clavicular line. Okay, so now here, what is the name of the line that makes the medial border of the highlighted region? So again, here's superior, here's inferior, here's lateral, and medial would be here. So they want to know, what is this line? So I'd be looking for something that's parasagittal or right through the clavicle, which would be mid-clavicular, one of the two. Okay, we'll take our last break.